Charity is a wonderful reflex. We should all be charitable, but how we're charitable matters. Every human being has intrinsic value.
Hi, I'm Jeremiah. Welcome to the Wake Up Call podcast, where we talk all things sleep, wellness, and health. The Wake Up Call podcast is brought to you by Polysleep, the best memory foam mattress in Canada. Hi, and welcome to the Wake Up Call. I am thrilled to have Sam Watts with us today. Sam is the CEO and Executive Director at Welcome Hall Mission. Today, we're addressing a pressing topic. How do people who are in the streets, homeless, or in precarious situation manage their sleep, health, and wellness? Sam, thank you for joining me today. What are you doing, and what is the purpose of Welcome Hall Mission?
That's a very good question. We have been around since 1892, so more than 130 years serving Montrealers in need. And our mission in that period of time has evolved quite a bit, because if you think about what the needs of Montrealers might have been in the 1890s, and then through the 1920s and the 30s and 40s and so on, the needs have shifted, and they've shifted an awful lot even since the pandemic. So what we do at Welcome Hall Mission is really two things. We're taking care of people who are experiencing homelessness and helping them get back into permanent housing. And we're also dealing with people who are having to address the challenges of food insecurity. So these are folks who struggle to make ends meet. And at the end of every month, they're trying to figure out, do I pay the rent? Do I buy boots for my children? How can I afford transportation? That sort of thing. And so these people would be coming into our two free grocery stores. One of them is in Montreal North and one of them is in Saint-Henri. And then along with those two entry points, so experiencing homelessness or experiencing poverty, we have a bunch of wraparound services. An example would be our free dental clinic. So it's a dental clinic in partnership with McGill, 6 dental operatories, very modern, and it's free, of course. So people who can't afford to get good dental care can come there for that. But they're always coming through one of those two entry doors. And so the mission has been around for a long time, largely supported by donations from Montrealers, for which we are very grateful.
That's amazing. Thank you so much for the details. Something quite alarming got out recently, published by Centraide. The number of people who are in homelessness or critical situation, I should say, drastically increased in the recent month, especially recent years, I would say post-pandemic. What exactly happened there?
All of a sudden, what happened was a confluence of events. So we had increased housing costs, we had a global pandemic, and we had a number of other things like inflation come to bear. And so what we saw was a number of people who had previously been right on the edge, just barely able to make it by, who were finding themselves increasingly pushed towards homelessness or towards greater precarity. Now that, coupled with the crisis that we've called the opioid crisis, which is really a crisis of a number of things that are coming together, and a number of communities where people had experienced trauma, all of this kind of combined to create something that we're seeing here in the Montreal area anyway, as it demonstrates itself as greater visible homelessness or greater visibility of people having breakdowns and that sort of thing on the street. It's always a little disconcerting when you go to your kid's park and you're picking up syringes, or when you see somebody curled up in an alcove, or when you see a woman walking across the street and absolutely losing it, having a moment, and you look and you say that person needs some assistance. But we're seeing much more of that visibility now here in Quebec than we ever used to. And part of the reason for that has been historically housing costs, the cost of renting a place, has been low here. But we've seen that, of course, increase by about 20% in the last number of years. And that has an impact on people, has an impact on affordability. And then I don't think I need to tell our listeners about the cost of food. And when food prices go up, that's something that's fairly elastic in somebody's budget. And so those are things that are contributing to both a greater number of people in need and also greater visibility of those people in need.
That's an interesting point you bring here, because that aspect of visibility, perhaps there was a number of homeless people that were out there, but we were not necessarily seeing them. And I think, like you said, walking through a park, going, for example, I do remember last week going to Chinatown, and I was just shocked by how many people were definitely under the influence and clearly living in the street. And I was wondering, how do organisms just such as yours manage with the talent? Because every company right now struggles to hire people. I'm sure it's no different for you guys.
Well, you've got a number of questions that are in that particular list of, I mean, the way I would tackle it is this, and I'll touch on something that you raised peripherally. One of the things that I think is important to recognize is that for years and years and years, organizations like ours and others kind of kept a lid on a pot that was simmering on the back burner of the stove. And so for most people, you didn't see what was going on because homelessness and people experiencing mental illness and things like that was kind of kept to less than desirable areas of the downtown core of most major cities. So it wasn't visible unless you went there. And why would you go there? So what has happened is that has spilled out into many different areas that were not areas where we traditionally saw people who were experiencing difficulty, even into the suburbs. We're seeing it now in virtually every borough of Montreal. Now, to come to your question about people and making sure that we can attract people and keep people to work in our organization, I mean, Welcome Hall Mission has 200 full-time employees. We don't have a lot of vacancies. We work very hard on retention, and there's a number of things that we do. But I would say that in general, we're a sector that has historically been under-resourced, under-equipped, underqualified in some cases. And yet, for some reason, we've inherited this charitable reflex of giving over the care of the most vulnerable in society to organizations that were not the best equipped to deal with it. And I sometimes draw a parallel to the hospital system. And I say, you know, if we were treating the hospital system the way we're treating organizations that are providing community services, it would be a bigger scandal than our current hospital system already might be. We don't have good-hearted volunteers running our hospitals, but in many cases in our sector, it's staffed by good-hearted volunteers who at the very best are way underpaid for what we're asking them to do. And so I think we're really on the cusp of what is going to be a necessary revolution in our sector, because we're going to have to ask ourselves as a society, is it right and is it legitimate for us to be turning over the care of our most vulnerable people to organizations that are underfinanced and don't have the ability to actually deliver what needs to be delivered? Now, the answer for us as an organization at Welcome Hall Mission has been to professionalize. So the staff that we have in our organization are people who are trained. I just left head office today and there were 15 people in a training session all day, frontline workers. And when I see that, I go, yay, that's exactly what we should be doing. We should be training. We should be developing. Many of our people have 4-year university degrees, have master's degrees. These are things that need to happen in our organizations that are serving the vulnerable, because we need to have people who are well qualified to do it. It's not good enough any longer to just be good-hearted. And I sometimes call it random acts of charity. You know, charity is a wonderful reflex. We should all be charitable, but how we're charitable matters. And so I think that's one of the takeaways that we need to all consider as a society and as individuals. How are we responding to people in need, and what's the best way to do it? And I guess I would argue that historically we maybe haven't been doing it in the best possible way.
Thank you for that. Very clear.
Does that make sense?
It makes total sense. And that's a perfect way to position it. I'm really focused within the company I built about sleep hygiene, health, wellness. When you're under such stress and pressure about thinking, am I going to eat tonight? Am I going to have a roof above my head? Your priority drastically changes. What is the reality of someone who's homelessness when it comes to health, wellness, and particularly sleep? How do they manage?
Well, you're going into an area that I think is very important, and it's something that people don't always talk about, which is the association of poverty and, say, homelessness with healthcare. Because I would argue that we're dealing with a healthcare issue. And we have always framed it as a social issue. In fact, if we rewind the tape to 50 or 60 years ago, we saw people who were homeless as people who had moral failure at some level. And so you still hear it today. Why don't they go get a job? Why don't they do this? Why don't they stop drinking? Why don't they stop taking drugs? That sort of thing. So we frame it as moral failure when it really is a healthcare issue. So now let's talk about poverty and let's talk about people who are experiencing homelessness. And what's the impact on their health? Well, all of us know, and I don't need to tell you this, that if you don't get a good night's sleep, if you don't sleep properly, if you don't get regular sleep, if you don't get proper rest in a good location, you're not going to be healthy. And so when you think about framing how people should be in the 21st century, we need to make sure that people have the fundamental building blocks for human health. As a society, how is it that we really want to be? Is it okay for us to let a percentage of our people just drift and be unhealthy? I would argue there's an economic cost to that. And so when I've talked to politicians who are, say, economically oriented, I remember making a brief presentation to Pierre Fitzgibbon, who at the time was the economy czar here in Quebec. And I said to him, look, it's an economic opportunity if we pay money to get people back into housing so that they're secure, so that they're eating well, so that they're sleeping well. Then all of a sudden they can be productive and contribute to society. Right now, what we're doing is we're paying a lot of money to simply put a patch on the situation for today. And then tomorrow they're coming back and getting the same thing that they got yesterday. And that is a huge cost to society. So the cost of somebody continuing to be homeless is much more expensive than what we call supported housing. And so ultimately what we need to do is take a good hard look at ourselves and say, wouldn't it be a good idea if we invested in people's health? And of course, that includes everything from making sure that they have an adequate place of shelter, a good night's sleep, I would add, as well as making sure that they have food to eat and a community of support. Those are the basic elements of human health. If you don't have that, your health outcomes are going to be suboptimal.
You're absolutely right. Anybody who went through depression, anybody who went through a burnout, you need to start with these building blocks again, making sure you're building back these habits. And without that, I can't imagine someone not having a roof, being able to really get the strength by himself or herself to get away from this situation. So
in the last 2 years, we have helped 400 people, it's actually more than 400 now, get back into permanent housing. But it still takes time for them to develop the habits of being housed and the habits of things like sleeping well, because they're used to irregular sleep patterns. They're used to having to scrounge around for the things that we would take for granted. And it's so interesting because one of the things I didn't know before getting involved in this sector was how creative somebody has to be if they're going to be living on the street. You have to think of an awful lot of things to make sure that you can survive. And what we need to do is channel that creativity a little better as a society, because that person housed can actually be quite productive. The same thing goes for somebody who's living right on the edge of whether or not they can continue to pay the rent of their apartment and take care of their kids and so on. It requires an incredible level of creativity for them to actually function. And again, if we can ease the burden, if there's a way that we can help, then those people are going to be healthier, they're going to live better, they're going to sleep better.
I want to go a little bit off topic here because we discussed that earlier, and I'm very curious about it. Since the pandemic, and especially since the rise of interest rate, everybody felt the pressure. How different we are and how different the situation we're in today is from a year ago. Not in terms of people literally being in the street, but people being on the edge of, people being under so much stress that they don't know, how they're going to make it. Did you see a difference in the people who come to your groceries, in the persona, the type of person that requires help?
For sure. There is a difference. We've seen it. We saw a difference right at the beginning of the pandemic even, because the people who were being added to the list of those in need of free food were people who were part of the gig economy and people who are working in hotels and restaurants, because as we remember, a lot of that sort of tourist industry, hospitality industry shut down. And so we had that group of people that all of a sudden were unable to make ends meet. But since I'll call it the end of the pandemic, because we're kind of in a post-pandemic period today, it's been new arrivals, single parent families, and older people. Whenever I've traveled all around the world and people ask where you're from, you say you're from Canada, you always get the same reaction. Like, Canada's brand internationally is wonderful. Like, everybody goes, oh, what a wonderful country. I've been there and I loved it, or I'd love to go there, or I'd love to live there. We need to make sure that when people arrive here as immigrants, that first of all, they're coming through the proper channels and they're doing it the right way, but also that they get well met and well taken care of. And so when I see people who've been here for a few months or even a few years and they're coming into our free grocery stores, I know they've fallen through the cracks somewhere. Something has not gone right for them. And many of these people are extremely well qualified. They were part of the middle classes or better in their home countries, and they're struggling now in Canada. When it comes to single parent families, we've always been able to identify that particular grouping of people as people who might be susceptible to struggle. And that just has continued post-pandemic, and we're certainly seeing a fair amount of it. Older people is one that surprised me, but it probably shouldn't have, because if you think about many older people who are living by themselves in an apartment, sometimes it's less than ideal accommodation. Through the summer months, we're always watching out for people who are living in non-air conditioned facilities, because that can be a problem. But a lot of these people were not seeing anybody. We'd deliver groceries to them because they were mobility impaired and so on. They wouldn't see anybody else from delivery to delivery. And so we started off this thing thinking, well, we need to reconnect them with the health and social services that we take for granted. We know that isolation is not a good thing. Anybody who's isolated is not going to have good health outcomes. And so that's another group of people that we're seeing that are struggling. And I think there's things that we can do about it. And again, we're back to what kind of society do we really want to be?
In addition to sleep challenges and nutrition, what would you say is the most significant factor that really underlay the capacity of someone to improve their life being homeless? Would it be the opioid crisis? Would it be nutrition? Would it be just the fact that the society is not properly adapted to answer these people? It could be mental illness. What do you see being the most significant factor influencing that?
Am I allowed to tick every box that you suggested?
Combination
because
of
it's all of them. And the interesting thing, and probably the big takeaway from your question, is to understand the complexity of the experience of homelessness. It's never one thing. It's almost always a series of things. Do you ever watch those summaries of accidents that occur? And if you look at a summary of an accident, like, that TV show about planes that crash, it's never one thing. It's always a series of things or a number of things that happen simultaneously that create the problem. The same sort of thing with a complex social challenge is it isn't usually just one thing. For example, if it was just alcoholism, if you could say, well, that's the problem, well, then we probably both know plenty of people who are alcoholics who are quite nicely housed. Thank you very much.
Yeah.
But when it's combined with family breakdown or mental illness, or loss of a job, or trauma that you lived in your teenage years that all of a sudden comes back to the surface, those are things that contribute to the experience of homelessness or the experience of some form of precarity that can manifest itself in a variety of ways. And so if I rewind the tape back to, say, 50 years ago, when we saw somebody who was homeless, it was almost always a man. It was almost always somebody between the age of 35 and 50. And it was almost always somebody who had a drug or an alcohol problem. Simple, right? Very easy to resolve, because you say, well, let's help the person resolve the challenge they have with addictive substances, and let's get them back into the workforce. But the problem is, if you look at homelessness today, it's so complicated, and every individual that we come into contact with has their own story and their own journey. And so the challenge for our frontline staff is to ask the right questions and help that person get on a pathway back into housing, and each pathway is different. And so sometimes when I do interviews in the media, they expect me to have like a 3 bullet point answer. And there isn't a 3 bullet point answer to homelessness. One of the things that has to happen is that our governments have to collectively work together so that we can actually begin to resolve the issue. There's been a lot of finger pointing. You'll have the feds and the province and municipality and the healthcare system all saying it's the other one's fault, or the other one has jurisdiction over a particular area. These are things that when we have something that is as complex and crosses over various ministries, various areas of responsibility, it takes everybody at the table. And that's where I think we're going to have to get to if we want to solve this.
I want to ask you a question that I think a lot of people feel bad about, but that feeling, because of probably our ignorance, is still something we have to deal with. When I was the other night in Chinatown, you see some of these people, they need help, but your first reaction is to either run away, you're a bit in disdain, what's going on? Am I going to be attacked? Am I safe? Why do we have such stigma? And what can we do about it? Because I guess it's really about being educated about. It's something new to me. It's something I'm not used to. I'm scared about it. And I do imagine that, unfortunately, a majority of people act this way. What can we do about it?
Well, to begin with, you just asked the right question. And that's where we have to start, is by ensuring that we don't other people. What I mean by that is there's a tendency to see us and them. Those people. I've heard that a lot. You'll hear somebody with, a microphone in their face and, well, those people. Well, those people is us. There isn't them and us. There's only us. I thought we learned that in the pandemic. We were all in the same soup together. So what we have to start with is understanding that every human being has intrinsic value. And if we start at that particular jumping off point, well, at least we have the potential of getting to the right ending point. But if we start off by finger pointing or by feeling fear, which is a natural reaction, right? We either feel fear or anger sometimes when we see some of this. And look, it can be frightening. I've heard the complaints of parents around facilities that serve people who are experiencing homelessness, like the day center in St. Henri. I've sat with the parents. I understand their concerns, and many of them are legitimate. But the problem is that we're not going to get to a solution by criminalizing vulnerable people or by trying to find a way to take fear and turn that into something that we can use as an instrument. I call it instrumentalizing fear. A number of weeks ago, a mainstream political leader held a news conference in which he called a facility that was behind him a drug den. That's not helpful. That kind of language doesn't help, doesn't get anybody anywhere. What we've got to do is find ways of addressing the challenge. And you do that by making sure that you understand to begin with that every human being is valuable. Every human being has a purpose and has that ability to get to a place where they need to be. And I think we can actually do it as a society if we want to. At the same time, we do need to be careful because some people would say to me, well, are you saying that we should just accept all kinds of chaos in our neighborhoods? And I'm not saying that at all. The reflex often is to say, well, let's bring in the police. And, that isn't really going to be the answer, partly because there's no way that we can hire enough police officers to properly oversee a huge social challenge. That's simply not going to happen. So what we need to do is actually address the challenge. And the addressing of the challenge always starts with pathways to housing. That's always the answer. Now, it's never easy, and I recognize that we're dealing with a housing crisis and housing's expensive and so on, but there are ways in which we can get the job done. We just need to get started.
What would be your wish from politics to help the situation?
Very good question. One of the first things that I tell every politician that I speak with is that this particular issue needs to be decidedly nonpartisan. And the minute we try to score partisan points with people who are vulnerable, we go to the wrong place, in my view. So the answer really is for us to recognize what the challenges are And a lot of them are relatively simple. We don't need to do any complicated studies any longer. We know what the issue is, and we know what the solutions are. What needs to happen, in my view, is that all of government, not just the province or the feds or the municipality, and the healthcare system, working with organizations like the one where I have the privilege of leading, we have to get around the table and say, now, how are we going to tackle this one element of it at a time? And like all things in government, I'm close enough to see how the sausage gets made in government. I sit on the National Housing Council of Canada, so I'm really reasonably close to the federal civil service. I see how difficult it is to sometimes get things done, but it also can be done if everybody agrees on what the problem is and everybody's focused on the solution. Now, one of the obvious solutions is to give something called rent supplements to people. So if you can supplement the rent, so if the rent is, say, $1,000 or $1,500, that if the person can only afford a small part of that, then a government subsidy covers the rest of that cost. Then you free up the person to use the rest of their income to buy food and so on. You're not necessarily going to lift them out of poverty, but you're going to keep them housed. And the other thing is to work on prevention. If we can prevent people from falling into homelessness in the first place, it makes it a whole lot easier to deal with those who are currently experiencing homelessness. Our problem right now in this city is that there's more entries into homelessness today than there are exits. And so if we can stop it at the entry point, then that becomes a big bonus. A number of key entry points, exits from prison, for example. We know when somebody's going to be released from jail. If we know that they don't have an address to go to, well, why wouldn't we start working 6 months ahead of the release date to make sure that they have a place to go so that we can ensure that they don't end up in the ecosystem of care for people experiencing homelessness? So that's just one example, but there are things that can be done. And like I've said, we know what they are.
And it's amazing because, in my opinion, they make a lot of economical sense.
Yes.
If you get someone out of prison, the last thing you want is someone who have the potential of doing something wrong again, of being in the street. You want the complete opposite. That person already cost tremendous amount of money to society. You want to have an opportunity for that person to join back society. I totally agree.
Give you another example. For years, children who turned 18 and were in foster care all across Canada, there were hundreds a week that were leaving foster care on their 18th birthday with very little in the way of a life plan. And one of the things that we discovered through some research was that if somebody found themselves in the adolescent care system, there was a very high potential for them to end up in the adult system for people experiencing homelessness. And so what we need to work on is to ensure that these young people are cared for in a way and that they have a life plan that they begin working on long before age 18. Now, here in Quebec, the Minister of Social Services has done some work in that area, and I'm very pleased to see that happen because it is making a difference. But it's something that we need to continue to work on because those are areas where people can find themselves in difficulty. And then you want to talk about a ripple effect through the healthcare system. Somebody who's unhealthy in their 20s and 30s is going to cost the healthcare system significantly when they get into their 40s, 50s, and 60s. And that's what we want to avoid. And so you're right to point out that there's an economic benefit if we can solve this problem. It's going to take some investment, for sure. This is not something that we found ourselves into in the past few months. It's been years of building to get to this point. So it's going to take us some years to get out, but we can if we start now.
What at an individual level someone can do if they see someone knocks at their window at a red light or they see someone in the streets in December? What should we do?
That's a question I get a lot. And my answer is always the same, which is I don't know for sure. A lot of this is very individual. And even for me personally, and I get recognized sometimes on the street by people who are serially homeless or have a tendency to go in and out of homelessness. And I carry around with me often some cards to a popular coffee shop And if I have a significant conversation with somebody, I'll give them one of those cards. That's just me. There are other people who feel good about giving a little bit of money, and if that's how you want to go, then that's great. My key point, though, is if you really want to be helpful, find a cause that pulls at your heartstrings. Find an organization that's really getting the job done. Do your research. Find that organization, and then link up with them and find ways that you can contribute. It's not always financial. Sometimes it is, and that's great when it is. Other times it can be by volunteering or doing other things for that organization. But I think there's this tendency for us to throw $5 at something or other, even to give to a charity consolidator and say, I've done my part. I always advocate, find that thing that pulls at your heartstrings. If it's children's lunches at school, if it's dealing with people getting back into housing, if it's making sure that people can eat, if it's education, if it's there's a number of things that that maybe pull at your own heartstrings, and then find that organization, or maybe a couple of organizations that are getting the job done in that sector, and then work with them. And I say, back to doing your research, talk to the people in those organizations, find out what makes them tick. Phone the CEO, talk to that person, talk to her or him, and make sure that they are getting the job done, and then align yourself with that organization, because that's how you can really be helpful. The sort of random giving of money or things, we often have people who want to give out sandwiches. I'll hear from somebody who call us up and say, I'd like to give out sandwiches. Where should I go? And our answer is, please don't. The need for people on the street is to get back into permanent housing. There are 70 places they can get a free meal. Meals are not the problem, housing is. And so if you want to help solve the problem, then align yourself with organizations that are helping to try to solve the housing problem that these people are experiencing, so that we can actually get them to a point where they don't need the free sandwich.
There's a certain amount of negative stereotypes that comes in people's minds when they see people who are in needs. My question to you is, how can we fight these? Because like we talked about earlier, it's not them and us, it's us all together. So what would you say to people who have this thought?
I'd say, first of all, that I understand it, because I think we all carry a certain amount of baggage with us. I'm somebody who has been fortunate in my life. I grew up in a middle-class family. We didn't have a lot of money, but I always knew that I was going to get a meal. And so even though we didn't have a lot of money, I was fortunate enough to have a decent education. I ended up in the corporate world. I did reasonably well. At 25, I bought my first house, that sort of thing. So I've been lucky. And so to some extent, we put our own autobiography over top of anything that we see when we see somebody who's not entirely like us. But we don't realize that that person that we're looking at may have not had the kind of pathway through life that we had. And so if we can at least begin by opening up the possibility to say, hey, wait a second, things went relatively well for me. And look, I could list a bunch of things that went badly for me too, that I recovered from, but not everybody is maybe as resilient as you might be or I might be. And so let's start with that as the starting point. Then let's also understand another thing, and I've used this parallel before. If someone was suffering from cancer, we wouldn't go, too bad for them, sucks to be them, let's let them figure things out. No, we would say, wait a second, there's hospitals, there's treatments, there's oncologists. Let's make sure that we get the person the best possible treatment. I don't think we've come all the way there yet on things like mental illness. Certainly the stigma has to some degree been removed, but if you look at the population that is experiencing life on the street right now, those who are visible, the people in Chinatown that you referred to, these are often people who have struggled mightily with a variety of different mental illnesses, and they need help. One of the things that we do at Welcome Hall Mission is we have a mental health program in conjunction with the Jewish General Hospital's psychiatry department. And I've seen the results from that. I've seen people who used to walk in circles in their parking lots and bang their heads on our walls who become quite normal, well-adjusted people after 8 to 12 weeks of treatment, and then get back into housing and are followed up by psychiatrists from the Jewish. That's great stuff, but it's not enough, and we need to do more of it. the stereotypes that we often have are associated with this failure for us to say, well, mental illness is much the same as cancer or diabetes or many of the other illnesses that are out there. And I think in a number of cases, we've begun to loosen up that stigma a little bit, but I think it's still there. I think there's still that bit of prejudice that we carry. And, I'm going to include myself in that. I'm probably as guilty as anybody, but now that I work in this sector, it's been something where a light has been shone onto it, and you can see it when you're there in the middle of the realities of every day and people who are struggling. And it's always kind of wonderful to see people who make that step towards recovery. And it's never perfect, and it's never a straight line. But one of the things that we know is that homelessness can be ended because we end it for about one person every 2 days at Welcome Hall Mission. We know that mental illness can be treated because we've watched it. I've seen roughly 100 people in the last 4 or 5 years go through the program and end up in housing and end up stable and followed up and on meds. So it's possible. And all it's going to take is for us to do it at scale, because it hasn't been done at scale yet.
If anybody who listens to the show today would like to help, how can we reach you and how can we reach Welcome Hall Mission?
Well, go to our website. That's the easiest way these days, isn't it? welcomehallmission.com, missionbonaccueil.com. We always like to hear from people. So anybody who's interested in helping in any way, I certainly invite them to contact us.
Sam, thank you very much once again.
You're very welcome.
Sam is the CEO and Executive Director at Welcome Hall Mission. If any of you would like to help financially or give some of your time, feel free to visit welcomehallmission.com. Thank you so much for listening to the Wake Up Call. If you liked what you heard today, do not forget to rate, follow, subscribe, or perhaps leave a comment below. New episode of the Wake Up Call drops on the third Wednesday every month. Make sure you're subscribed so you don't miss a single episode. For all of us here at the Polysleep studio, I'm Jeremiah Curvers. Until next time.